All right, so we are going to finish off the presentation that we started last time. So this is part 2 of the introduction to the nervous system. So we discussed the brain and also the spinal cord. So in the previous discussion, we ended on the termination of the spinal cord. We also discussed the arrangement of the nervous system in the spinal cord, where we discussed to say, when it comes to the spinal cord, the gray matter lies centrally. It is inside. It's located central, whereas the white matter is located peripheral. Remember that gray matter is nothing but the cell bodies and their dendrites, whereas white matter is the axons. So this area, we're going to find axons all over this area. Then inside here, we're going to find the cell bodies and the dendrites. Before I even go any further, I would like you to see this structure here. We call that as a ganglion, all right? So ganglion is a collection of cell bodies outside the central nervous system. Inside the central nervous system, we call it gray matter or nuclei. I explained this in the previous discussion. This is another ganglion. So here we're saying post or posterior dorsal root ganglion. Posterior dorsal root ganglion. So this is anterior part of the spinal cord. That is the posterior part of the spinal cord. You can differentiate it by these two swellings here. These are the anterior horns. No, sorry, the fissure, sorry. This is anterior median fissure. This depression here separates more like halfway the spinal cord from the left and the right side. Equally on the back, we have a smaller fissure, which we call the posterior sulcus. So in terms of depth and width, this one is larger than the posterior one. So that's how we can differentiate the anterior part of the spinal cord from the posterior one. In this same region, there is a central artery of the anterior spinal artery. So this position, you're going to find the anterior spinal artery running in the same depression known as the anterior median fissure. So we have another ganglion here. So that's a cell body. So here just one cell is shown just for representation. There are more cells than one in there. Okay, now, when you're examining the spinal cord, the naked eye, we see that the core, of course, is gray matter, then the surrounding area is white matter. Now, let's observe that the gray matter is going to give us two horns. In total, there are three. Okay, but first of all, let's talk about the two horns. So anteriorly, you have two horns, this and this one. So this area here is looking like a projection. So there are cells in here and there are cell bodies and dendrites. Then the axons are now leaving the spinal cord. So they are a large collection of cells, and you see that the axons now leave and form, spinal nerve. So this is a spinal nerve. Then, so what is coming from the gray matter is motor nerves. So these nerves are leaving the spinal cord, whereas those nerves are entering the spinal cord. So nerves enter the spinal cord from the posterior surface, or what we call the dorsal surface. So that is a dorsal horn or posterior horn. This is a anterior horn. Sorry, the anterior or ventral horn. Now, motor nerves leave the spinal cord. These are what we call efferent nerves, whereas sensory nerves or afferent nerves enter the spinal cord. So you see that at any given time, most of these spinal nerves have a combination of a sensory and motor nerve in one. So at this stage, we can't call this as a nerve. Neither can we call this as a nerve. It's at this stage where we can call it a nerve. So it is carrying both motor and sensory. Sensory is going back to the spinal cord. Motor is going to the body. but we call this as a single nerve. Same thing here. Nerves here, the ones in red, are leaving the spinal cord. Blue, entering the spinal cord. All right. So all these entering the spinal cord are sensory because they are bringing information to the central nervous system. Like that. Like that. So because of that, the gray matter of the spinal cord has two horns. Two lateral horns, two ventral horns, this one and this one. They are in front because they are facing in front. They also have two dorsal horns or posterior horns. They are facing at the back. Those two. So in short, in summary, ventral or anterior horns carry motor nerves or motor neurons. These are leaving the spinal cord, whereas posterior or dorsal horns are carrying sensory nerves. But the cell bodies are here. All of them are here. That is about the two major horns of the gray matter of the spinal cord. Two anterior, two posterior, entering, leaving the spinal cord. Now, when you reach the region of the thoracic, spinal region, the part of the spinal cord that passes through the chest. Let me take you back. This one here, this segment in purple, is going to have additional horn. We call that as a lateral horn. This one. These swellings are called the lateral horns. And they give us what we call the sympathetic chain. Sympathetic chain carries sympathetic nerves. And we know what the sympathetic nervous system does. All right. So it controls unconscious movements of the body. We're talking about blood vessels. We're talking about glands. We're talking about the heart. We're talking about the lungs. Control of that is because of the sympathetic nervous system. Those nerves that form the sympathetic nervous system are arising from the lateral horns, not from the anterior and dorsal horns. No, they are coming from this part. So also supplies the digestive system to control motility of the digestive system, glands in the digestive system. Remember that sympathetic and parasympathetic performs under subconscious control. But the origin of those nerves is from the lateral horns. Okay. Then, what about the white matter now? This surrounding area. So the white matter equally is divided into three columns. We have the ventral column and this ventral column. So remember, ventral and anterior is used interchangeably. So whenever you hear ventral, just think of anterior. So a ventral column, it is white because of this area is filled with axons. There are no cell bodies here. If they are there, they are very small in number. So we have two anterior columns, left and right. This one and this one. So these are the two ventral or anterior column. Then we also have similar arrangement at the back. That's a fissure there, separating the dorsal column or posterior column, if you like here, they are showing them as posterior white column, this one and this one. Okay. In addition, we also have the lateral columns, this one and this one. Now, all of these, the white matter is filled with motor as well as sensory tracts. Now, what do we mean by tracts? So here we have bundles of nerves that are transporting impulses to and from the brain. So the brain will be up here. Then this is spinal cord. Then down there we have the coccyx. So we have nerves that are transmitting impulses towards the brain. So those are sensory tracts because they're transporting information towards the brain. They are carrying information that is coming from various parts of the body. Then we have motor tracts. Now, motor tracts are composed of nerves that are transporting impulses from the brain, from the brainstem, from the cerebellum all the way to the spinal cord and out of the spinal cord to the body. Okay, so let me just quickly summarize that one. So here are those pathways now. Okay, so remember this is gray matter, and gray matter is just cell bodies, and we are saying we have 3 horns, 2 lateral, 2 anterior or ventral horns, this one and this one, 2 dorsal or posterior horns, that one and that one, 2 lateral horns, this one and this one. Then the remainder is white matter. White matter divided into ventral column, this one and this one, posterior column, that one there, even this one. These are the dorsal or posterior columns. Then these are the lateral columns. These lateral columns. Now we're saying within these, there are nerves that have been identified as transporting information towards brain, transporting information towards the spinal cord from the brain. Okay, so let's begin with the sensory pathways. So these nerves are ascending. So all sensory pathways are called ascending tracts. Ascending because they are transporting information towards the brain, and all of them are sensory. Remember, the brain should receive sensory inputs, work on it, and generate motor outputs. So let's begin the sensory one. So we have what we call the spinocerebellar tract. Spinocerebellar tract. Okay. So now the spinocerebellar tract is the dorsal column. This one here. So it is transporting information. Sorry. Spinal cerebellar tract. Not this one. Okay. This is spinothalamic. This is dorsal column. So the dorsal column is for the thalamus. Okay. So spinocerebellar tract transports information to the cerebellum, and the information it carries mainly is unconscious proprioception from the lower limbs and the trunk. Remember what I was saying about the cerebellum, to say cerebellum, its main function is balance as well as coordination of muscle tone. Okay, so like the amount of force you need to perform a certain task, all that is coordinated by the cerebellum. Okay, and its tract is this one here, the dorsal column. I think, yeah, here, the tip of the dorsal column. So nerves found here would transport information to the cerebellum from the trunk and from the lower limbs so that we can maintain posture, especially while standing. So muscles sending information to the cerebellum will receive now motor command from the cerebellum to say, okay, this body is sitting, this body is lying, or this body is standing. So muscles in certain areas should be tense, muscles in certain areas should be relaxed so that posture is maintained. Then we have the dorsal medial column, which we call also as the spinothalamic tract. Spinothalamic tract. Dorsal, meaning at the back now. Okay. So dorsal, but medial. This is the midline. Now, if you come closer, that is dorsal. It's at the back. This one in the lateral, we are saying is for the cerebella. But the one closer to the midline is for the thalamus. So we call it the spinothalamic tract. Okay, so information passing through this region will go to the thalamus. The thalamus, we're saying, is part of the diencephalon. Okay, and we're saying the thalamus acts like a relay center or like a network tower where signals will go and then be sent to the right part of the brain. Okay, so what type of information passes through this tract? Number one is proprioception, which is balance from joints, like knee joints, hip joints. The next is vibration, so senses of vibration, like you are seated and phone is vibrating. All that information is passing through the spinothalamic tract. Fine touch, for example, like running a feather or something that is light on the skin. The body will be able to feel that That information is reaching the brain by the dorsomedial tract or the spinothalamic tract, and also from the joints for proprioception and balance. Okay. Then we look at the anterior lateral system, okay, or the anterior spinothalamic tract. Anterior spinothalamic tract, this one and this one, these two. What type of signals are they transporting to the brain? So this one transports deep pressure or touch. So this time when there's real touch like handshake, someone is palpating the skin, we are feeling that sensation because of information passing through this anterior spinothalamic tract. It's going to the thalamus, of course, but it's transported here. So here we're saying fine touch at the back, but anterior-wise, we have deep touch. In addition to that, this part, even though it is anterior, but it's a bit lateral, this one here, this extension and that extension, it is carrying pain and temperature. So temperature and pain from various areas of the body, the skin, will be transported here to the brain. Okay, now you and I know that temperature beyond certain degrees becomes pain. Okay, so it's easy to interpret temperature as pain because the tract or the nerves that transmit these two types of sensation are close to each other. Okay, so you feel that high temperature no longer as temperature, but now as pain. So this one, strictly the anterior-most part would transmit deep pressure and deep touch, or what you can say crude touch. Then this lateral end will be for pain and temperature. Okay. All right. That being said, we can now look at the motor pathways. Now, these are pathways that are going to transport information from the brain to the midbrain, to the brainstem, sorry, from the brain to the brainstem, and then to the spinal cord. Remember, we had brain like the telencephalon, diencephalon, then we have the brainstem, then we have spinal cord underneath there. So once we have thought about it, so on and so forth, how does that information now transport from the brain to reach the spinal cord, that now these nerves that leave the spinal cord can go and affect what the brain is, interpreting. So we have two types of tracts that are restricted for motor output. So sensory is bringing information to the brain, and I've explained these tracts. They are found all over in the white matter there. Okay, now let's look at those restricted only for motor output. So blue was saying, oh, this is sensory, but these two in green are restricted for motor output. So we have two pathways. We have what we call pyramidal and extra pyramidal. Okay, so pyramidal transport electrical impulses from the cortex, the brain itself, to the brainstem and to the spinal cord. So there's communication between the brain, the cerebrum, and the brainstem. Remember, brainstem is midbrain, pons, and medulla oblongata. Okay. Apart from that, the cortex will also transport direct to the spinal cord. So some nerves will go to the brainstem, then finally go to the spinal cord. Whereas some nerves will come direct from the cerebrum all the way to the spinal cord. So such kind of nerves, we call them pyramidal tracts. So these are more like roads in which impulses will pass through. All right. At the same time, we have what we call extrapyramidal tracts. So these nerves originate from the brainstem. So they have nothing to do with the cortex. And in the previous discussion, we agreed to say the brainstem, its main function is subconscious control, whereas the cortex is conscious control. So in short, pyramidal tracts transport conscious response of the brain to stimuli. Okay. So for example, movement of the limbs, so on and so forth, writing, touching, throwing something, all that information is coming from the brain through what we call the pyramidal tracts. Those, axons are running through the brainstem or going direct to the spinal cord, but their origin is from the cerebrum. Whereas extrapyramidal controls subconscious function. So they have nothing to do with conscious control. These are things that we're not aware of. Like, for example, secretion of certain glands, constriction and dilatation of certain blood vessels. All that is because of nerves that are originating from the brainstem. So that's a 2. And when you're doing pharmacology, you learn of drugs that have what we call pyramidal effects. There are also some drugs that have extrapyramidal effects. So think of conscious as well as subconscious control. So where is pyramidal and extrapyramidal coming from? So in the medulla oblongata, you see that there are these swellings. We call these as pyramids. Okay, left and right pyramids. Then there's a fissure there. So this fissure of the medulla oblongata is continuous with the anterior fissure of the spinal cord. This one here. It goes all the way to the medulla oblongata. Remember, medulla oblongata is the last part of the brain. After that is spinal cord. So that name comes from here. Now, in the medulla oblongata, you see that there's decussation. So nerves cross from one side of the body to the other in the medulla oblongata. So we call that decussation. We call that as decussation. So nerves that are coming from here will cross to the other side. Nerves that are here will cross to the other side. So as information is coming, for example, this is the right side of the brain. When it reaches here, it will jump to the left. Same with nerves that are coming from here, they will jump to the other side. Okay, so most nerves from the spinal cord, as they are climbing up to the brain, when they reach the medulla oblongata, they cross to the other side. Same with motor nerves that are descending from the cerebrum, going to the spinal cord. When they reach the medulla oblongata, at this level, they will decussate and jump to the other side. That's why you see in most cases, patients with stroke, cerebrovascular accident, when there's damage to the left side of the brain, you see the effect, especially in motor function, on the left side of the body because of this decussation. What you are seeing here are now cranial nerves. These are cranial nerves. Cranial nerves, cranial nerves, cranial nerves, which we'll discuss sooner. Okay. Again, this is the same diagram trying to help us understand pyramidal and extrapyramidal. Let me close this one. What can I do? Stop video. Okay. All right. So this is a cerebrum. This is a brain stem. Okay. That is a midbrain, pons, medulla oblongata. So you see that nerves are originating from the cortex there, then coming all the way. In the medulla oblongata, what happens? The nerve jumps to the other side. By the way, not all of them jump. So some fibers, nerve fibers remain and continue on like that. So equally, nerves that were originating here, when they reach the medulla oblongata, will jump to the other side and come out on this side. So you see this nerve in the brain, origin is there, but the part of the body to control will be this side. And the same will be for nerves originating there. Okay. So function is already shown here. Function of pyramidal tract, voluntary muscle movement. Function of pyramidal, extrapyramidal is unconscious. Control muscle tone, body posture, locomotion, and so on and so forth. Okay. Let's look at cranial nerves. So cranial nerves in total, they are 12. So this one mainly is not easy to master at first glance. It will take much of your time. So what you can do is in your free time, have a look at these functions. Okay. The best summary I can do is that we can divide the brain into 3 parts. The brain can divide it into 3 parts. So we have what we call the forebrain, midbrain, and hindbrain. I can take us back to that diagram we looked at last time in the previous discussion here. This is telencephalon or cerebrum. So cerebrum, together with the diencephalon, forms the forebrain, right? Then this is midbrain. Midbrain is part of brainstem. That is midbrain. Then what remains now? Pons, medulla oblongata plus cerebellum belongs to hindbrain. So this is a brain that is in front, which is cerebrum plus diencephalon. Then the brain that is in the middle is a midbrain, this one here. Then the brain that lies at the back is pons, medulla oblongata plus cerebellum. So this part here, and you add cerebellum, is hindbrain, midbrain, forebrain plus this one. So when it comes to cranial nerves, the first two cranial nerves, okay, first two cranial nerves will originate from the forebrain, this part here. The second two cranial nerves, so cranial nerve number 1, number 2, their origin is, or in short communication, they communicate with the forebrain, this one. Then cranial nerve number 3 and number 4 communicate with the midbrain. Then now cranial nerve number 6, 7, 8, 9 communicate with the pons. 10, 11, 12 communicate with the medulla oblongata. Okay. Did I say it correct? Yeah. So 4, 4, then 1, 1, and 2. Okay. So that is cranial nerves. There are 12 in total. Not this one. All right, here. So cranial nerve number 1, optic, as well as olfactory and optic nerve communicate with the forebrain. Oculomotor and trochlea, midbrain. Then the remainder is hindbrain. The remainder is hindbrain. Okay. So there we have them. Cranial nerve number 1, number 2, forebrain, just on like that. Okay. And their function is summarized here. Olfactory nerve is, this is a nerve for smell. It is found, it picks up sensation from the nose. Optic nerve in the eye, so sight or vision. Oculomotor, this is a major nerve of the eye. It supplies many muscles of the eye, so it helps in eye movement. It also helps in constriction of the pupil, as well as movement of the eyelids. Then trochlear nerve, or cranial nerve number 4, this nerve is involved in inferior movement of the eye. So for us to look down without moving the head, just the eyes, it's the trochlear nerve, but it's supplying muscles of the eye. Then trigeminal nerve, this mainly controls sensory and motor movement in the muscles of chewing or muscles of mastication. So we find these muscles in the jaw, upper and lower jaw. It's trigeminal nerve, which is divided into 3 branches. There's a branch that goes to the region of the eye. We call that as the ophthalmic branch. There's a branch that goes to the maxilla, branch going to the mandible. So they are V1, 2, and 3. Then we have the abducent nerve, or otherwise known as cranial nerve number 6. Function is lateral movement of the eye, so looking sideways. Okay, it's very difficult to look sideways at the same time. That the left eye will look sideways and the right eye sideways at the same time. It's very difficult. So it's one at a time. So you find that when you're moving, for example, the right eye to look sideways, the left eye will look inwards. Okay, so that you must take note of that. And then cranial nerve number 7, otherwise known as facial nerve, is the nerve for facial expression. So frowning, smiling, all that is facial nerve, and also helps in tongue movement, moving of the tongue in and out of the mouth. Then cranial nerve number 8, otherwise known as vestibulocochlear nerve, it's a nerve for balance and hearing. Okay, so it's one nerve but it has two functions. One nerve, known as the vestibular nerve, comes from the vestibule itself, found in the ear. Then the auditory nerve, which comes from the cochlea. So auditory nerve is for hearing. So this nerve, at some point it will split, yes. One will go to the back of the brain for hearing. Then this one will go to the cerebellum for balance, the vestibular nerve. Then glossopharyngeal nerve. It's a nerve that goes to the tongue and it helps us to taste food. It helps us to swallow because it supplies muscles of the pharynx and also the larynx. It helps to pull the larynx up and allow muscles in the pharynx to relax so that we can swallow food. Then vagus nerve, this is a wandering nerve, so it is found all over the body, in the neck, in the chest, in the abdomen. So its main function are summarized as controls digestion, heart rate, and also involved in unity. Okay, blood vessels constricting and dilating. Vagus nerve is involved. Then accessory nerve, mainly this nerve supplies muscles in the neck region. And we know that for the head to move, it's because we are depending on the muscles in the neck. So it helps in head and neck movement. Then we have the last nerve, known as cranial nerve number 12, or hypoglossal nerve, which is involved in tongue movement. Now, for tongue, changing of the shape of the tongue. Okay, so it supplies muscles of the tongue. So like depressing the tongue, lifting up the tongue, all that is hypoglossal nerve. Okay. So here we have a diagram showing us each nerve and where they are going and the function. All right, so autonomic nervous system, we discussed it in the previous discussion, so I'll not dwell so much on that. Here we have the summary. We're saying the sympathetic nervous system origin is from the thoracic region and the lumbar region. So it's called thoracolumbar origin, and then goes to all these parts of the body here. Again, you can work this one out in your own free time. Then parasympathetic, we're saying the origin is craniosacral, originates from the cranium. So most of the cranial nerves plus nerves in the sacral region. Remember, there are 5 in the sacral. So this is their function on the body. So you have reproductive system, bladder, intestine, so on and so forth. Right. So enteric, also we discussed this one, the way back and the Meissner's plexus. So that is a submucosal plexus, or otherwise known as Meissner's. This is a myenteric, or otherwise known as way back plexus. So the way back is responsible for motility of the digestive system, whereas the Meissner's or submucosal plexus is responsible for dilatation of blood vessels in the submucosa for absorption of food from the digestive system. Okay, so apart from that, we have what we call lumbar plexus. So these are things we can skip them. They are not for our level. So a plexus is nothing but a collection or network of nerves. So we have about 3 plexus. Okay, so the first one is the cervical plexus. So these are spinal nerves leaving the region of the spinal cord found in the neck here. So we call it cervical plexus. So most of these nerves control muscles in the neck and in the arm. So mainly it's the arm. So all muscles in the arm are controlled by the, sorry, let me just correct that one. Cervical plexus supplies muscles in the neck and the skin. All right. All right. Then also have what we call the brachial plexus. So brachial plexus is a combination of nerves in the neck region and the nerves in the chest region. So the brachial plexus is restricted to the arms. So that's why it's called brachial. The arm, the upper arm is known as the brachium. So that is the brachial plexus there. Its major function is to control muscles in the arm. Okay. Cervical, I was saying muscles in the neck. Okay. Then we'll go to the lumbar plexus. So lumbar plexus mainly forms nerves that supply the abdomen as well as the lower limbs. Okay, we have the femoral nerve. Origin is from the lumbar plexus. Genitofemoral nerve, this nerve is going to the femur, to the thigh region as well as the genitals. Okay, then ilioinguinal, these are going to the abdomen. Blood vessels in the abdomen, muscles in the abdomen, and the skin of the abdomen. Then sacral plexus, the major nerve from there is the sciatic nerve. We know the sciatic nerve controls muscles in the leg. Okay, that's a sciatic nerve there. The muscles of the thigh is a femoral nerve. Muscles of the leg, it's the sciatic nerve, the largest nerve in the body, apart from the spinal cord anyway. Okay. Then we have what we call dermatome. So what a dermatome is simply an area of the skin supplied by a single segment of the spinal nerve. So for example, spinal nerve arising from the area of the spinal cord lying in the chest at the same level with rib number 7, this one here. You see that it's going to supply only this part. Above it will be 6, 5, on and like that. Okay, so we call that as dermatomes. So really not so much significant, especially to our training, but for physicians, this is very cardinal, and those that do dermatology. So for example, conditions like herpes zoster, you see that usually there's hypopigmentation of the skin because that virus, the varicella zoster virus, damages the dermatome because it is affecting the nerve supplying that skin. But usually you see that that lesion of herpes zoster doesn't cross to the other side because we have nerves coming from either side of the spinal cord. So we have nerves coming from the left, nerves coming out from the right as well. So herpes zoster usually affects one side. So if it's this one, all the area of the skin that this nerve will supply will be bent. And that's why there is that loss of skin color. So you don't find that a person with herpes zoster, that lesion is spreading across from one side of the body to the other, like here, where it is bending from here and crosses to the other side. It's not possible because nerves will come from this side and end here in the midline. Another one will come from here and end there. So that's why those hypopigmentation in herpes zoster doesn't cross to the other side of the body. If that occurs, then it's another condition, for example, vitiligo or other skin disorders. So end here for today. These are other things that you can just read through. These are reflexes, for example, which nerves are involved. Really not so much, but just for your own information. So we are done with the introduction. Now we'll start looking at parts of the brain one by one. Again, as usual, if there are any questions, I'm available for consultation. We end here.